Should I charge GST? Should I apply for GST number? What is the situation vis-a-vis healthcare professionals, vis-a-vis patients, vis-a-vis vendors, vis-a-vis labs? Everyone is charging GST from us. Can't we charge the same from the patients? What is our stance? What should we do? Who needs to apply for a GST number? If you also have these questions lingering in your mind, please do watch video. Please do watch this video till the very end. Hi, I'm Dr. Bhavdeep Ahuja. I'm a dentist, 23 plus years of experience along with dentistry. I'm training and coaching colleagues on the topics of practice management, medical legal aspects, ethics, consent, documentation, and finances in dentistry. So in this video of mine, I will be divulging a few things about the GST part. In my recent interaction on an online webinar that I was doing for all the orthodontists from the IOS, Indian Orthodontic Society, on the invitation of my dear friend, Dr. Balwinder Thakkar from Jaipur, who is the current IOS president. So after the webinar, I was having a few questions. There was one interesting question that actually caught my eye. So of course, we have all listened to these kind of questions. So what was the question? Let me just read it out for you. So we know GST isn't required for our profession, but since doctors, orthodontists need materials to work with, GST is charged by the vendor. Can we register and file GST return if we are willing to? So let me just set the context right here that we as dentists are belonging to the healthcare community. So healthcare is exempt from GST as such on a broader basis. The only places where you are charged GST in healthcare is where you are doing cosmetic procedures, that to above rupees 20 lakhs. Now, what do I mean by cosmetic procedures? You can say smile designing, veneers, any aesthetic procedures involving anterior teeth, which are not functional in nature, are aesthetic in nature. If you are doing that to the tune of rupees 20 lakhs a year, which is roughly more than 1.5 lakh a month in value for such procedures, then you need to apply for a GST number and file the GST return accordingly. But otherwise, for routine healthcare patients, neither you need a GST number, nor can you charge GST from your patient. I understand that we are being charged GST by our dealers and our labs, but we need to understand that we won't be able to claim input credit on that GST from the government of India. We do have to pay GST, but we can't claim it back. So it's as simple as that. But yes, as I said, aesthetic procedure will require that. So till so far, it is there. You can't do that. But I hope this sets the context in the right frame for you regarding GST. Now, another further question in continuing with this is always, which I get from colleagues, is whether this applies to allopathy or Unani or Siddhi or other branches of Ayush or medical. It applies to all: medical, dental, Ayurvedic, homeopathic, Unani, yoga, Siddhi, every branch. So healthcare means it includes every branch. So recently in the previous budget, 2022 union budget, February 2022, the finance minister introduced a GST on the hospital room rent if the same exceeded rupees 5,000 per day. But otherwise, healthcare services provided by even the hospitals are exempt from GST. Yes, certain consumables outside at the pharmacy might be chargeable, but overall, it is free from that. So I hope it sets apart all the doubts in your mind regarding the GST. So if you find value in this video, please do like and share with your friends and colleagues. And please do subscribe to my channel. And I see you soon with another of my video next Wednesday. Bye-bye. Take care. Have a great day.